Well, good morning. Yesterday, I was at the White House at the invitation of the President to update him, the Vice President, as well as others from the administration and the Coronavirus Task Force about Iowa's approach to COVID-19, especially as it related to our aggressive testing strategy, robust case investigation, all to contain and manage virus activity here in Iowa. I was also proud to be joined on the trip by Dr. Padati, who shared with the President and those in attendance what her and the team at the Department of Public Health are seeing in the data as it relates to virus activity. She did such a good job in answering the President's questions that during the press conference he invited her to be a part of the Coronavirus Task Force. And one of the reasons I think that this is really exciting is because there is no representation from a state level on the Coronavirus Task Force. And so I think that will allow kind of a state's perspective to be heard as we work through the coronavirus pandemic. So good job, and thank you for joining me there, and great work on the Department of Public Health. It was also an opportunity for me to highlight Iowa's role in feeding the nation and the world, some of the significant challenges that we face related to that with COVID-19, as I was able to highlight 10% of the nation's food supply is produced by Iowa farmers. Nearly 80% of our workforce was essential and remained open as we moved through COVID-19. Our strong manufacturing base that's focused on food processing and supply chain, our essential workforce and infrastructure is critical to keeping the food supply chain open and moving and food on the table. We talked about the proactive measures that we're taking to protect our most vulnerable Iowans and keep essential workers safe while businesses are up and operating. The importance of PPE, the CDC and OSHA guidelines for processing plants, and the Defense Production Act, and how our strike teams are conducting surveillance testing, both diagnostic or serology, of employees, sometimes both, at our long-term care facilities, manufacturing and processing plants, and how this process has really helped us identify positive cases, isolate those that are testing positive, help them get on a path to recovery, and really start to understand the scope of the virus activity and provide assurance to employees of a safe work environment while keeping our essential businesses operating safely and responsibly. We also talked about our launch of Test Iowa and the importance of our assessments and increased testing capacity, again, to help us manage virus activity, protect the health of Iowans, and get our economy back on track. In fact, I was proud to relate to the team that since March, we've actually increased our testing capacity by 800%. We were doing 300 a day in March, 1,300 on average in April, and we're averaging about 2,900 now in May. And how we're really utilizing the Iowa National Guard, the Department of Public Health, and the Department of Human Services to expand our really important case investigation team. You know, when Iowa moved to substantial spread in mid-March, we put in place targeted mitigation efforts to slow the spread, flatten the curve, to prevent overwhelming our healthcare systems. And I'm proud to say that Iowans do what they always do, and they responded. And that really gave us time to put in place our RMCCs, RMCC regions, to really collaborate with our hospital systems in each of these regions, and eventually we were able to identify on a daily basis to Iowans the number of beds, ICU beds, and vents that were available, that were in use, and that were available. And today we have 79% of our ICU beds available and 74% of our vents that are available for patient care. So since then, since we kind of really accomplished what we were trying to do to make sure that we had the healthcare resources available, we now have shifted our focus from mitigation of resources to managing and containing virus activity as we begin to open Iowa back up. Another part of Iowa's response to COVID-19 has been keeping Iowans informed. And since the first positive cases of COVID-19 that were confirmed in Iowa, it's hard to believe, that was literally just about 2 months ago, we've communicated with Iowans through nearly daily press conferences. We've leveraged social media and launched a dedicated website. Our goal from the start has been to provide Iowans up-to-date information regarding COVID-19, our response, and what they could do to protect their health and the health of others. As the weeks have passed, we've worked to improve the information we provide and really how it's delivered. from reporting more information to making it more accessible. And today I'm pleased to announce additional changes to the state website, which you can find at coronavirus.iowa.gov, that will make it easier for Iowans to, again, assess the data, access the data, and information that shows what's happening across our state. We've created a more visual dashboard that allows you to follow trends on a daily basis and filter data down to a specific day or county so Iowans can access the information that's most relevant to them. Another benefit of this change is that information will now be timelier. Currently, there's some lag time in reporting our numbers. For example, when I reported the daily numbers at Tuesday's press conference, they reflected a 24-hour time period starting the previous Sunday at 10 a.m. to Monday at 10 a.m. Now we'll be able to report cases from 12 a.m. to 11 p.m. the previous day, providing information sooner and giving you a better sense of the current situation. Because of this change in the reporting time frame, the total case counts you see on the website today now include tests reported from 10 a.m. Tuesday through 11:59 p.m. last night on Wednesday. Because of the reporting time change, all daily numbers on the site now reflect cases from 12 a.m. to 11:59 p.m. each day, so they will not match up with what we previously reported. I can assure you that the numbers are accurate. They just reflect a different period of time from when we were originally reporting. I've heard many anecdotal stories about Iowans who have created spreadsheets to carefully track the numbers from day to day. So if you've been doing that, the latest change means you won't be able to reconcile your numbers with the updated information that's now on the website. But we do have a new feature that I think you'll appreciate. You can now export the data from the website to a spreadsheet or a variety of other files. And so that should make the data more functional for you. And that really is the purpose of the latest update to our website. You can also see the case counts for every day since our first positive cases. Having the ability to look back over time has been a regular request, but providing this information has not been easy until now. Providing more information to Iowans, making it easier to understand and access, and being transparent with the type of data we're using to inform our decisions. This site, it's also very interactive, which is something that I really like. And one of my favorite features is, again, the ability to drill down to cases by county. So if you click on the county, if you click on any county on the map, or even multiple counties at once, some of the data on the page updates to reflect the area that you selected. You can access also Test Iowa data, including the number of assessments completed by age and gender, and a breakdown of county. You can also continue to access data that has been regularly reported, including hospital resource data through the RMCC report and information about our long-term care outbreaks. One data item that continues to be of interest is the Epicurve, which is now represented in multiple ways on the website, and I've asked Dr. Padati was instrumental in making that possible, so I've asked her to explain more. Dr. Padati?
Thank you, Governor Reynolds. Again, I think when we talk about an epidemic curve or Epicurve, this is one of the important ways that public health epidemiologists look at information. And this is the time element of the person, place, and time data that we use to understand a disease or a condition. And so what you'll find on the website will be another Epicurve. In fact, you'll see two. And one of them is going to report total tested people by day, so that's the time element, and the other will report positive cases by day, again providing that element of time to understand trends. And that's an important part of assessing this virus and our response as we move forward. And it's an approach that we've taken in public health over the past several decades with regard to flu. It's important for us to be able to assess overarching trends at the national, state, and local levels to help us understand disease activity and where to target resources to help implement public health measures that will help keep people safe and healthy.
Thank you, Dr. Padati. I really appreciate the work that you and the team did to make the data more meaningful for Iowans. So I hope everyone will take some time to explore the new features on the website and find what's of interest to you. So again, just go to coronavirus.iowa.gov. Data about virus activity across the state really has continued and will continue to help us drive the decisions we make about how to contain and manage it and begin to gradually reopen businesses in a responsible manner. Just as we can't stop the virus completely, we also can't keep businesses closed and our lives restricted indefinitely. And effective tomorrow, some additional restrictions will be lifted. Dentists may resume dental services in compliance with certain requirements, including those that were adopted by the Dental Board, and they must also have adequate inventory of PPE and a plan to conserve it. Campgrounds, drive-in movie theaters, tanning facilities, and medical spas may reopen according to business guidance from the Department of Public Health. And effective statewide tomorrow, the following businesses may open according to public health guidance: malls at 50% capacity with common seating and play areas closed, and some retail establishments may reopen at 50% capacity as well. As we have seen this week, business owners will decide whether the time is right to reopen their doors, just as Iowans choose whether or not they will resume some of their normal activities. Regardless of our individual decisions, we must all continue to take personal responsibility for our health and the health of others by continuing to practice all preventive health measures and reduce your risk to being exposed to the virus or exposing others. Social distancing, careful hygiene practices, wearing a mask if you choose. It's how we continue to interact in public. It's how we'll continue to interact in public for some time so that we protect ourselves and those who are the most vulnerable. So again, if you're a vulnerable Iowan, 65 or older, or you have some underlying conditions, continue to stay home and to really manage your exposure to the virus. So thank you for doing your part, and with that, we will open it up for questions.
Governor, yesterday Vice President Mike Pence said that Iowa has been a success story. Do you agree with that? And if so, what are you basing that on? And do you believe that we've gotten over the peak?
Well, so I do think we're shifting in the way that we're talking about the virus and how we maintain it. So originally, as we talked about, our goal was to stabilize, to really make sure that we were flattening the curve, that we were slowing the spread, that we weren't overwhelming our healthcare resources. And as I said in my remarks, through the RMCC and what we've been able to do, and because Iowans really adhered to what we asked them to do with the targeted mitigation efforts, we now know the amount of ICU beds that we have available, the number of vents that we have available, the surge plans that hospitals have put in place to be prepared for an outbreak if that should happen. So I think one of the things that they talked about that we have done kind of uniquely in the state of Iowa is our aggressive testing capacity, especially with our role in manufacturing and our long-term care facilities. So by being able to provide increased testing capacities to our processing plants, both diagnostic PCR and serology testing, we are able to identify quickly the number of positive cases, the number of negative cases, isolate the individuals that are positive, get them on a path to recovery, separate the lines so we're not mixing positive individuals and those that have tested negative, as well as providing appropriate PPE, doing measures inside of the plant to continue to protect this essential workforce, and really start to understand the scope of the virus and continue to not only protect the employees, but to keep our processing plants up and moving, our manufacturing plants up and moving, to do everything we can to protect our most vulnerable in our long-term care facilities, and again, really start to mitigate some of the impact from the virus. So from that perspective, yeah, I think we're an example that other states can follow, and because of the data and the robust case investigation and tracing, that also provides us the data on how and where we need to really target our approach to get in front of some spike or some additional virus activity that we're seeing in, counties, in communities and what that may look like and how we can be proactive in addressing that.
I think reviews of data of multiple states that we've seen on NPR and some other national publications have shown that Iowa doesn't necessarily stand out in its test capacity. Test Iowa hasn't ramped up yet, and Iowa is one of the states where the virus is spreading the fastest, including some of the communities like Sioux City that have had explosive growth in cases. So how do you...
Well, just as Dr. Burks indicated with us as well, Iowans can be proud of what we're doing. You should be proud of what we're doing. We are leading, and we're leading by example, and we're going to continue to lead. We've ramped up our testing. We've increased it by 800% since March. We are in a pandemic. We have a rapidly changing environment, and we are reacting and being proactive at the same time. When we had a chance to talk to them about how we're aggressively utilizing testing and contact tracing and working in partnership with our manufacturing facilities, they didn't understand that we were going to the hot spot and we were testing. So of course our positive cases are going to increase, and of course we're going to continue to see that. But we're also, like we did with some of the plants, we're going to identify, we're going to separate, we're going to mitigate the exposure, and we're going to be able to get them back up and increasing their capacity at these plants so that our farmers who are producing meat supply for the country and for the world can continue to do what they do and play a critical role in feeding the world. And so this is a finely oiled machine, and we have to make sure that all aspects of it are working appropriately. And so we've got farmers that are raising hogs and cattle and producing, and we got manufacturer processing plants that need to be able to process. And so we need to do it responsibly and safely, and we are doing that. And so evidently they do think that we're doing a good job. That was the comment that he made. And as I said, I thought Dr. Badati did an excellent job of talking about virus activity and how we're managing it, what we're seeing from the data, and how we're really utilizing that to be proactive in our response. And evidently she did it well enough that they thought that she should be a part of the coronavirus task force. So I think Iowans should be proud of that, and I know that I certainly am. It's not perfect, but I think we're doing everything we can to really take care of Iowans in a responsible way, but also to get this economy up and going so Iowans can get back to work, and we can do everything we can to get our lives somewhat back to normal.
Governor, you traveled out of state obviously yesterday and have chosen not to self-quarantine upon your return. Should Iowans feel safe now to travel wherever and not take that precaution?
So again, Iowans need to make those individual choices themselves. They need to apply personal responsibility, take into account where they're going, what they're doing. I didn't use commercial flight. I talked about that before I left. I took a test at arriving at the White House, an Abbott test to make sure that I tested negative. They took my temperature about every time I turned a corner. I left the White House and came back home. So, but again, Dave, people need to start, they have to make these personal decisions. They have to apply personal responsibility. If you are a vulnerable Iowan and you have underlying conditions, then you maybe need to rethink, your travel and probably continue to stay home and limit your trips outside of the home.
Governor, I have a quick question for you about the meatpacking plant situation.
Yeah.
I know the governors of Nebraska and South Dakota have said that among meatpacking plant workers, they live in close proximity, and perhaps some of the spread is among the community itself and has nothing to do or little to do with where they work. Do you agree with that concept of the rapid spread among people who live closely together? Obviously, I think a lot of people believe it started at the meatpacking plant, but what's your take on that?
Yeah, thank you for that question. I think it's another example of a place where we've continued to learn more about this virus, and we're going to continue to do so. So just like when we think about the spread of other diseases, other bacteria or viruses, we think about opportunities for those kinds of things to happen. And we know about this virus that being in close personal contact is one of the risk factors for allowing this virus to move from one person to another. And that's why a lot of the recommendations that we've made are really focused on ways to limit that interaction and limit those opportunities. And so I think taking everything together, we certainly know people who live in households might be spending time in close proximity. And if there are other opportunities or places where people might potentially be in close proximity, that's exactly why we're trying to reinforce, older people and people with with underlying conditions should not be in those situations and should be still staying home. And also reinforcing things like social distancing and the use of cloth face coverings in public if you're unable to maintain that kind of distance. And so regardless of the setting, I think keeping in mind that what we know biologically is that being in close contact is a potential risk, that helps us guide the recommendations and public health control measures that we put in place in a variety of settings.
Governor, I think part of that was to basically say that regardless of what the meatpacking plants did to protect their workers, the virus may have spread anyway.
And absolutely, as Dr. Brodati just said, it's in households, that's where we're seeing significant spread. I think, just the fact even with the Governor Cuomo, when he was doing his press conference yesterday, one of the things that he reported out was that 66% of the hospitalization came from individuals who had sheltered because they were sheltered in or had sheltered in. And so, we learn every day. So we are seeing it spread within households, especially generational, but with the large households, and we're seeing it also then when they go to work in close proximity like that, it tends to spread as well.
Can we assume from that there's maybe a broader change of thinking now that the restrictions we did may not be, either weren't necessary or aren't necessary for the future based on what you're learning about the virus?
Yeah, well, so what, kind of that's what I was saying in the remarks. I think originally it really was about protecting Iowans. There were so many unknowns, and it was about managing our resources. The early projections were like, thousands of Iowans were going to be impacted, hospitalized, the number of deaths, the number of potential vents that would be needed. So we just didn't know, and we didn't have a good understanding of what our resources were. So while 80% of our businesses were up and going and remained working because of our essential workforce, we did put targeted mitigation efforts in place. And by doing that, really kind of limiting the activity, asking for social distancing, closing down some of our non-essential businesses, and Iowans really responded. They did a great job. And because of that, that bought us time so that we could put in place the infrastructure and the system to understand where those vents and beds and ICU beds were at, not only from a state perspective, but from a regional perspective. And I think now that we've done that, and now that we've seen based on Iowa data what some of our numbers are, and so we're changing our strategy, I think, about how we look at this, like we do with the flu, kind of like Dr. Brodati said. So we're looking at containing and managing, which allows us to continue to open up in a very safe and responsible way. We're not opening them up at full capacity. Most everything is at 50% capacity. We're asking them to still social distance. We're still limiting social gatherings to 10 or fewer. So, we're doing it in a responsible manner, and Iowans need to continue to be mindful. But I think we need to also, that allows us to move to the next phase and really start to open up and realize that we can do that in a responsible and safe manner. And I've been so impressed with the businesses and the churches and everybody. They really are being very responsible. They're making their decisions on whether they're ready to open up, if that's the right thing for them to do, and how they're doing it. They're paying a lot of attention and utilizing the Department of Public Health's guidance that they have put in place for them to kind of walk through when they're thinking about reopening. And so my hope is, as we continue to watch the trends and monitor the virus activity, that we can continue to open things back up as we move forward.
Thank you, Governor. You occasionally mentioned the serology testing. I think you did earlier again today here. I'm just wondering if you would be willing to tell us a little bit more about that specific kind of testing, just how and where the state is conducting that, and where that type of test specifically fits into the bigger picture of informing the decisions you make.
Yeah, so that was another aspect that we got to really highlight at the meeting with the president and team yesterday, and I'll have Dr. Brodati give you some more details, but we've been using it at some of our processing plants, and we've also been using it with our long-term care facilities. And I'll let Dr. Brodati talk about kind of what we're gathering from those testing options.
Thank you. So again, I think that what we've seen in the several months that we've been responding to this new virus is that we continue to learn more and continue to adjust our response, which is a critical thing to be as flexible in adjusting the way that public health, laboratory, and clinical partners respond to things as we learn more. And I think that that's something that we'll continue to do as we monitor virus activity. And one of the things that we've continued to look at are other ways to gain insight into what that activity might be. And so a test like a serologic test, which looks for the presence of antibodies, is one potential way to understand people who might have been exposed but perhaps didn't realize it or weren't tested. And remember, we've seen about 80% of people who have been infected with this virus have either had no symptoms or been very mildly ill, with about 20% of people, having more severe outcomes. And those are those people with underlying conditions and older people who we're really trying to protect and make sure that we optimize outcomes for by, putting systems in place and partnering with our clinical partners. And so a tool like serology might help us understand a little bit more about the patterns and activity level of this virus. And it's something that we still need to learn a bit more about, because we need to understand if you detect those antibodies, are they working to protect you? We need to understand that. And how long do they work to protect you? Because we know that there are some diseases that you can be immune to for a lifetime, and others where it may only last a couple of months or somewhere in between. And so it's an example of a place, again, that we continue to learn more, but it's something that we've offered as a way to help, again, understand a little bit more about the trends of this virus here in Iowa. And it's something that we're going to continue to work, again, with our partners throughout the state on to help understand how we can direct resources and make decisions that make the most sense for Iowans for how we live, work, and interact.
Chris, KCCI.
Hi there. Got a two-pronged question, but I think it should be pretty quick answers. What specific data points were used to guide the reopening decisions announced yesterday? And where exactly does Iowa rank among the 50 states in terms of testing rates?
So again, some of the criteria that we used, again, remember we're shifting strategy, so we now have identified that we have the resources available to take care of Iowans in the case that they would need to be hospitalized or we saw some type of a surge. And so we're looking at virus activity and virus trend, and so that allows us to start to look at various communities, start to open up Iowa and continue to move forward with those efforts based on what we're seeing across the state. So, and it's not just a snapshot of time. We're looking at trends. We're looking at it a 3-day, a 14-day. We're looking at positivity rates. We're looking at hospitalization. We're looking at a variety of things. But I think really we do, as we think about how we start to open up the state, it is about containing and managing the virus so that we can early on with the data that we're seeing on a daily basis, really start to identify where we're seeing some activity, where we're potentially seeing some clusters of increased activity, and that allows us to get in and just to maybe do additional testing so we'll know what is the scope of the virus that's happening there within the community. It may mean that we need to get into the community and provide them some additional education to just say we're seeing a little bit of a flare-up, so be mindful about that. If you aren't feeling well, if you're a vulnerable Iowan, I think it's really important that you stay in and protect yourself. And so those are some of the things that different ways that we can help manage this as we move forward.
Great.
I can't remember the other question.
We're going to go to Nick at Des Moines Register.
Yeah, thank you, Governor. What do you say to Iowans who are still waiting for their Test Iowa results a week or more after being tested?
Yeah, I think we're caught up. So we're caught up with the test. I think that was Tuesday. At the end of day Tuesday, we were caught up. So we ran about 2,000 Iowa tests through that have been validated and they have been reached to. But if you haven't received yours for some reason, just call the office and we can help facilitate that. But the backlog is caught up.
Last question, we're going to go to
Okay.
Last question, we're going to go to KTIV in Sioux City.
Good morning, Governor. Michaela Feldman, KTIV. You made the announcement yesterday to open certain businesses in Woodbury County tomorrow. That's earlier than first planned, but numbers here in Woodbury County are continuing to increase. I mean, today we're seeing our deadliest day with 3 deaths. Are you concerned that you've decided to open businesses here in Woodbury County early while we're seeing an increase, and what went into that decision to open earlier?
Well, it's just retail businesses, and again, it's 50% capacity. They need to continue practicing social distancing. They also need to continue to proper hygiene and do additional sanitations to be able to open. Again, Iowans will make the decision whether they want to go to the facility or not, but we've done it on a very limited basis. And, you know, just like people are going to the grocery store, this isn't, you know, it was a fairness issue and really opening up retail statewide. And again, if you're not feeling well or you're concerned or you don't think you're going to be able to social distance, wear some type of a face covering. If you're sick, stay home. And if you don't feel comfortable going to these establishments, then don't go.
Thanks, everyone.